Right, good morning everyone. My name is Dan Wellings. I work for an organisation called the King's Fund, and I'll explain a little bit more about who we are in a second. Can I just start by saying that actually these days are some of the most interesting days that we do in this job, because the system doesn't always understand all the views out there. So I'm looking forward to hearing those views. I'm looking forward to the disagreements. I'm looking forward to the agreements when they happen, and everyone contributing to the debate. So, in about 10 minutes, I've got the slightly difficult task of explaining the health and social care system to you. But there are a few messages that I would really like you to take away from this presentation. The one thing is, the three messages to take away are, it's big, is the first thing that I would say. It can feel incredibly complex, particularly to those of us that are looking at it the whole time, and there are repercussions for that complexity. And there are a huge range of different organisations providing our care and support and the healthcare we need. And they come from public services, from private services, and from voluntary services. So if you remember nothing else that I say today, if we can remember those things, that would be really helpful. So, just briefly on the King's Fund, we are what's called a think tank. I suppose the way that I would describe that is we provide an independent evaluation and commentary on the system. We're not part of the system, but we do work very closely with the system on events like this. So, the NHS. So there are 1.3 million people employed by the NHS. The key word there is employed, because actually when you look at the totality of the health and care system, there are more people working on behalf of it, as well as that 1.3 million. We'll come to GPs in a second that actually aren't included in that figure. And what do we mean by NHS organisations? You will all have your own views. If I said the word NHS, you will always have organisations that you think of immediately within that. Often people think of GPs and hospitals, but there are a huge range of different organisations that are providing the care and support we need. From charities, people will have heard of things like Macmillan nurses. There are chemists who have contracts with the NHS to provide the medications that we need, to dispense products. And we talked about GPs briefly before. Actually, the vast majority of GPs aren't NHS employees. They are independent contractors, small businesses, if you like. And they provide care through what's called a central GP contract. And I also add, there's lots of things around the sort of dentist and pharmacy. So what you can see from this is that you've got sort of what we could call public services, but we've also got the voluntary sector, charities, and what we call private sector as well. So there's a huge range. So under this huge banner of the NHS, we've got a huge range of different organisations. So, that is just the NHS. We've also got social care. And one of the things that we find about social care is that whilst people are pretty good in terms of understanding the NHS, social care is one of those areas where people perhaps don't understand it as well. So I thought it'd be helpful just to give an overview of what is social care. People may be aware of things like care homes, care that people receive in their homes as well. But this is a really helpful definition. It's any help that you need, such as personal care or practical assistance to live your life as comfortably and independently as possible because of age, illness, or disability. So things like dementia, people with learning disabilities, working age adults that need help in their home for activities. Does that make sense to people? It's a different thing from the NHS. And crucially, it's not provided by the NHS. It actually comes under the responsibility of local authorities. So that's something we don't always, people sometimes can be a bit confused, even those that work in the system. When does the NHS start, finish, when does social care kick in? But the key thing to remember is this is actually under local authorities, not the NHS. And even within that, under local authorities, although they pay for it, or we might use this word commission, you can imagine that they're commissioning services on our behalf, and they are commissioning those services from upwards of 90% is provided by about 21,000 different organisations. When we think of the NHS and the social care system, depending on how you count this, there's upwards of 50,000 different organisations. And that shows you that all of the organisations involved in this care, and this is provided by private and voluntary providers. Think of care homes, for example. There are some big companies that run these, there are independent providers. So again, we're reinforcing that message of the range of provision within these areas. I thought really helpful just to briefly go into this. The NHS is primarily funded through taxation, primarily. We have things like prescription charges and other things, but primarily funded through taxation. Social care is not. So social care is determined by two things. Whether you need it, we set something called an eligibility criteria, which is, do we think this person is appropriate for social care? And then we means test it. And by means test it, it's really dependent on how many assets you have. And there's a threshold for that. Okay, so it's a really different funding system, and actually that's a very thing that people don't always get straight away. So hopefully that's helpful to place this discussion in its context. But let's try and bring this down to us and who looks after us. This is the King's Fund's attempt to simplify everything that I've just told you. We may have failed. But in the top left-hand corner is kind of government and the Department of Health. In the bottom right-hand corner, you don't have to look at the detail, is the providers of our care. It's incredibly complex, this system. It's why people like us exist, to try and make sense of it, and sometimes we struggle as well. But actually, if you look at a patient or patients, this is a much easier way of explaining what we call, this is something from National Voices a number of years ago. They asked Malcolm and Barbara, one of whom has dementia, one of whom has a carer, the range of different people that are looking after them, or different elements of the care that they need. Does that make sense? So what you can see from that is that all of these different people are involved in this couple's care. From local authorities through to the voluntary sector, through to public services, through to GPs that we said were a slightly different service. And that's one of the challenges, is how does the system use this information together to make sure that you can receive the care and support that you need. And the same, I won't go into detail, but this is someone with kidney disease, and all of this is in your packs. But this is, again, it shows the complexity of this. Some of us just use GPs, but actually with people with long-term conditions, these are things, these are all of the different people responsible. And it can feel really difficult for that person at the centre. Yeah. So I'm going to finish up now. But really, 4 days now to start thinking in real detail about how can the health and care system use information to support better care. I think Mark was really clear earlier on about there's far more that can be done, but there are some big, big questions that need working through, and that's why we're here today. Thank you for your time. I look forward to the discussions.